Special guest in the studio with us today. We're very honored to have Secretary Rick Brajer, who is the Secretary of the Department of Health and Human Services. Sir.
Thank you so much, Wayne.
Appreciate you coming in.
Well, it's a pleasure to be here.
First of all, Mr. Secretary, people think of Raleigh, of course, the capital city, and they think of government, and
Right.
government is always big and it's enormous, and they don't really know what goes on there.
Sure.
Give me an idea, if you would, in simple terms that even I might understand, what the Department of Health and Human Services is. I mean, I know it's an enormous department. It's one of the
Right.
biggest in the state, if not the biggest.
It is. So during the storm, there was a medical support center, that was set up here in Goldsboro. It was DHHS, our employees, who set up that support center. When there was a shelter being set up in Lenoir County and operated before the Red Cross came in, it was social services in combination with our social services department. Down the road is Cherry Hospital that really it's a state psychiatric hospital that takes care of folks with really the most significant of needs that we have in the state. That's DHHS. Caswell Center is just down the road, where we're taking care of folks with intellectual and other developmental disabilities combined with important either medical needs or behavioral health needs. That's DHHS. Right now we're in the process of allowing people to sign up for disaster food stamps in the counties that were most affected. Getting those disaster food stamps approved by the federal government is DHHS. So that gives you a sense of who we are and how we fit in.
Wow. You affect a lot of people.
We really do. Just thinking about the Medicaid program alone, it's 1 out of every 5 North Carolinians. So that program alone touches 2 million people in the state of North Carolina.
Wow. You mentioned Cherry Hospital. We're very proud of our new hospital.
For good reason.
Oh man, it's a beauty.
You know what? It's beautiful from the outside as a building, but you know what's really beautiful is the interaction between the caregivers, meaning the nurses and the psychiatrists,
Yes.
as well as the patients that are there. That's really a sight to behold, and it's being operated at really the highest of standards in the U.S.
It took a while for us to get to the point that we could open it and look at it, but now that's all behind us, and we're very happy that it's open.
Yeah.
And many of us have gone out and toured it, and it's an absolutely beautiful place, and it's certainly doing wonderful work out there.
It really
we're very
is.
proud of Mr. Welch, Lucky Welch, and of course all the doctors and the caretakers out there doing a wonderful job. What brings you to the eastern part of North Carolina?
It's really to come back to these state facilities and say thank you to all the folks who made incredible contributions during the storm. As an indication, at the Caswell Center, where we're taking care of folks with really significant intellectual and other developmental disabilities, there were 16 employees there who literally lost everything. They lost homes, they lost cars, but they showed up to work and worked 12-hour shifts and stayed at Caswell because of their commitment to people. So I came there to thank them, to hear their stories and to thank them. Here at Cherry Hospital today, the same sorts of stories happening at Cherry Hospital. And oftentimes, as you might imagine, the employees that took the brunt of the storm are among our lowest paid state employees. And to see that the level of commitment that they showed, it's something that not only we as a department are here to thank them for, but Governor McCrory asked me to come and personally thank them on his behalf.
You have been secretary since last August, I believe. Is that correct?
Correct.
What is your background? I've read your bio, and it's very interesting. You're very active with Habitat for Humanity.
I am.
That's one of our favorite organizations here.
Absolutely.
And in Wake County, I believe you were the chairman.
I was the chairman of the board
Right.
there. I've been in healthcare my entire career, but what motivated the change a year ago is that I've been thinking about public service for the last couple of years. I'm a first-generation American. My parents emigrated from Yugoslavia. And really, I've been thinking for several years, what's a way of saying thank you to a country that made a home for my parents? Our family's been blessed incredibly by the freedoms and opportunities in this country. And so, but I never had the privilege of serving in the armed forces, as so many people do in eastern North Carolina. And so it was a way of saying thank you and giving back. So it was a way of building on the leadership experiences that I've had in my career in healthcare. But ultimately, it was the governor, and I really believed in Governor McCrory's vision for results-oriented and citizen-centered government, and therefore saying thank you to the country.
What do you see for the future of Eastern North Carolina? We have historically had been somewhat, if you want to say, behind in the economy. The economic environment of the region has been a bit behind the Piedmont and the mountain area, in fact. But what do you see here that would be built upon in the near future for Eastern North Carolina in healthcare?
I believe it's already been announced. The governor has set up essentially, I forget the name of the committee, but it's essentially a large task force of private and public sector folks coming together to really work on the restoration of Eastern North Carolina, not just from a housing standpoint and from a facility standpoint, but from a jobs and education standpoint. And so Governor McCrory has already put that in place. I know that Secretary Scrivala, who heads up the Department of Commerce, has been working actively on bringing jobs to Eastern North Carolina. My area of responsibility is to say, hey, listen, how can we address the health disparities in Eastern North Carolina relative to the rest of the state? Exactly. So what do I mean by that? For example, in the area of infant mortality, there are counties in Eastern North Carolina where over 1 out of every 100 children die in their first year of life as a result of both factors that are in control of the parent, but many of them are out of control of the parent. You know, we're investing in workforce development from a healthcare standpoint, meaning that there are 20 counties in the state of North Carolina that don't even have one OBGYN. Oh my. We've got 20 counties that don't even have one psychiatrist. And so there are just really big gaps in terms of primary care, general surgeons, OBGYNs, and state psychiatrists. So what we're working on right now is a way of funding, if you will, graduate medical education, so that we're producing, if you will, doctors who will commit to living and staying in rural areas of North Carolina. Now that's important not only from a healthcare standpoint, but from an economic development standpoint, because there's an economic multiplier, meaning money multiplier. When you bring a doctor in, generally the value that comes to the community is like 1.3 or 1.4 times the value of what that doctor brings in. So whether it's addressing health, whether it's investing in economic development, Governor McCrory is strongly committed to these types of initiatives, and our role as a department is to really follow through on those.
You mentioned doctors coming in. Are we seeking doctors? Are we seeking new personnel?
A good example is Cherry Hospital. So as part of Cherry Hospital, we will increase capacity by 116 beds, meaning 116 more patients. Well, there are roughly 3 employees that are hired for every bed, if you think it on a facility-wide basis. Right. So we're going to be hiring more psychiatrists, more nurses, more technicians, more folks who cook food, more people who clean, the building, et cetera. So we're looking in total of adding about another 373 jobs just in Cherry Hospital alone. So yes, we are committed towards building, investing in Eastern North Carolina.
Wow, that is wonderful. So would you care to venture 20 years from now? Where do we stand then, or is that too far out? Don't let me put you on the spot here.
Exactly. Honestly, what they put me in charge of is to say, hey, listen, how do we improve? How do we work on overall health improvement?
Right.
And I can tell you that what I'm committed to is making sure that health in the eastern part of North Carolina is as strong as our largest urban centers, not 20 years out, but 10 years out and hopefully earlier than that. And if we invest in what's called workforce development, if we invest in what are called social determinants of health, food, transportation, education, and if we continue to educate folks and invest in them, we really can address that. And infant mortality is a great place to start.
Well, what about challenges? There has to be challenges.
So what are the challenges? One is that everybody's focused on an insurance card, right?
Yeah.
So you'll hear people talking about Medicaid expansion as a way of giving people access to insurance. But in fact, in eastern North Carolina, if you don't have the doctors in place, if you don't have, and if you don't have these social determinants in place, you can't make progress. So the challenges are the things that people are not focused on. So for example, in eastern North Carolina, these rural areas where we produce all this food, counterintuitively, we have our greatest food scarcity in rural areas of North Carolina. And when you don't have access to high quality food, that impacts people's health. We have the highest obesity rates. That's a real challenge. So educating people, engaging the faith community, engaging people individually around the right practices, around, just putting on a pair of tennis shoes and taking a deep breath and walking outside, just walk around the block. Yeah. Those are, so it's changing, supporting positive behavior change would be an example of really a challenge, but a good one. So we're up for the challenge. The governor, as you know, you've seen him during this storm recovery. He's got a can-do spirit all the way around, and that spirit really infiltrates in the teams that he leads.
Secretary Rick Brajer is the Secretary of the North Carolina Department of Health and Human Services. And sir, we appreciate you coming in.
Thank you so much,
Thank you so
Wayne.
much. Right.